And turning to your health news now, do you and your family members know your wishes about treatment in the event of a medical emergency? Talking to your doctor about your future health care can actually save you and your loved ones stress and anxiety down the road. Dr. Iris Boettcher is a board-certified geriatrician rather. I got your last name right, with Spectrum Health Medical Group, and she joins us now with some great insight. Thank you so much for being here with us.
My pleasure.
So I'm going to try to say it one more time, but what exactly is a geriatrics? Geriatrician.
A geriatrician is actually the opposite of a pediatrician. It's a physician who specializes in the problems of older adults.
Okay. And how do you know actually when it's time to see a geriatrician?
There's usually a set of circumstances. People are becoming more dependent on the care of others, have multiple medical problems or on multiple medications with complications.
And I'm understanding advanced care planning that we were talking about. What exactly is that all about?
So advanced care planning is something that all adults should do, which is planning ahead for future health care decisions. And the most important part of that is designating an advocate to speak for you when you're unable to, and that person should be well informed about your goals and preferences when it comes to making health care choices.
So it sounds like there really isn't an age when a geriatrician comes into play, is there? It's kind of more based on someone's health?
It's more a set of circumstances, yes, that's correct.
Yeah, okay. All right, well, of course, it's very hard getting that conversation going because it's hard to look down the road, but what are some key pointers you have for people to get that conversation going?
Well, I think it's important to plan ahead, and it's really important that we understand and know the goals and preferences of an individual, because they're all individual. And so it's really a conversation about how you want to live rather than how you want to die. And so it's important for families to have that conversation with their loved ones.
All right, and there's a doctor's dialogue that's coming up. I know Spectrum is really great about trying to pull the community into these. We have the information on the screen, but if you want to go ahead and talk about the upcoming doctor's dialogue.
Sure, that's scheduled for October 21st at the Prince Conference Center, and we'll be talking about advanced care planning, as well as there will be an audiologist there to talk about hearing problems in older adults.
Okay. If people come to one of these things, what should they bring along with them as far as different types of questions? Or I'm assuming you guys are there, you're kind of an open book for people to approach you, right?
Yes, the majority of the discussion is question and answer. We'll be presenting some key points, key talking points initially, and then open it up for questions and answers for audience participation. Okay.
And not everybody might be able to make it to that, so if they cannot attend that, what is the best way to reach out to you to get some of these questions answered?
You can certainly call our office, which is the contact information, I believe, is on the screen, and or contact Spectrum Health, the medical group.
Any common questions, I think, that really come to mind that maybe you were used to answering? Anything that really jumps out in your head that people want to ask?
As far as advanced care planning? Well, I think it's really one of the things that is common is that people designate when they're doing their estate planning an advocate, but oftentimes that advocate is not informed about goals and preferences. So it's really important to have a conversation around goals and preferences with your advocate and your family members.
All right, and like I said, as it transitions nicely into David L. Carrier, who comes on, who talks about elder law a little later in the show today, so we'll tackle those topics when it comes to the actual finances. All right, thank you so much for stopping by and joining us here today.
Sure, my pleasure.
Absolutely.
Thank you.
Yep.